And here is where we are going to get into the most questions. And guys, I'm telling you right now, we've got a gazillion of them. Okay. Um, so, um, somebody's asking, so, I saw that parents can be a paid caregiver for individuals with medical complexities. What qualifies for those medical complexities? If we're talking about a child under the age of 18, we're talking about those. Either if structured family caregiving is an option for your waiver, it's meeting that extraordinary care need, which is just care beyond what is typical and age appropriate. But if it's for an hourly service like attendant care or PAC services, it's that extraordinary care and intensive nursing needs. So when they're looking at medically complex, they're looking at intensive nursing needs. Um, let's see. Um, Here's a question. I have no idea how to answer it. With the health and wellness, and part of the reason why I'm going to say that is I've got case managers on here who will eventually give me an answer to this question. That's why we are crowdsourcing answers here. Um, with the health and wellness waiver, my son is a level 3. If for whatever reason he fell to a level 1 based on the new assessment, would he still be eligible for the waiver? And so that's where I'm going to say, the eligibility for the waiver is really based on the inter RAI level of care assessment tool. Um, and for the skilled nursing waivers, there are 3 different ones based on age. For the developmental disability waivers, there are 3 of them based on age. And so that is really what is guiding the eligibility question or the level of care question. So it's not specifically a diagnosis. Although diagnostic information plays a part in it, medical records can play a part in it. But frankly, I'm not 100% sure what you mean by level 3 versus level 1. But when it comes to maintaining that waiver eligibility, that level of care eligibility, it's about the assessment that is being done. So somebody is asking, it's my understanding that CMS has not approved these changes going into effect August 1st. Is that true? It's my understanding that they have. Um, that's my understanding. Um, and certainly the state is moving forward as if it has already been approved by CMS. Um, so that it is my understanding, the state's implementation date on all of this is August 1st. Um, okay. Um, And guys, at this point, I'm also going to kind of take some of the other questions that have come in that don't necessarily relate to paid caregivers, but the people have the questions anyway, so I'm going to answer. My son years ago was diagnosed with partial fetal alcohol syndrome. Plus, he has a head injury from an accident when he was 14. Now, where do we start to get a current diagnosis to start getting the assistance started? So, first of all, especially with both FASD, fetal alcohol spectrum disorder, and with a head injury, one of the things I would do is I would get an updated psychological evaluation, a neuropsychological evaluation, in part so that we can also see if your son has an intellectual disability, which is an IQ of around 70 or below, because that alone can be a qualifying condition to apply for a waiver. If your son actually has that diagnosis of a fetal alcohol spectrum disorder, or has a traumatic brain injury diagnosis, that can open up those doors. So I would start with getting an updated neuropsychological evaluation, seeing exactly what that says. Then give us a call here at the Arc, and we'll talk through what your best options are at that point. Okay. Um, okay. Let's see. Okay. Sorry. I'm reading this question and trying to process. I just applied for waivers for both my father and my daughter. I'm a live-in caregiver for both, and my father was put on the waiting list. Um, I'm confused by this next part, but daughter was determined to meet nursing level of care. It says she may be eligible to receive nursing facility program for all inclusion, health and wellness pathways for aging, or TBI waivers. What do I need to do next? Okay, there's a lot built into that is being merged together. Um, your dad's been placed on the waiting list. I am guessing your daughter has also been placed on the waiting list. Whether you get the pathways for aging waiver or the health and wellness waiver is based on your age. So since your daughter is under the age of 60, it would be the health and wellness waiver. The TBI waiver would only apply if she had a traumatic brain injury. What I would do is I would go to there is a waitlist portal, a waiver waitlist portal that the Bureau of Disability Services has created. I would go in there and it will tell you what um, well, because one is pathways and one is likely health and wellness, it'll tell you what their waitlist date is to give you a better idea of what's going on there. Single parent caregiver of a young adult on the CIH waiver. When I spoke to my agency, they told me that if I had a spouse, both of us could be paid 40 hours a week, and that would be a total of 80 hours of care. Absolutely correct. My child has plenty of hours beyond the 40 that I am working on their behalf, but we have been unable to find a reliable secondary caregiver. Not uncommon. So, because I'm not allowed to work more than 40 hours, my child doesn't get the same amount of hours that a child with two parents gets, even though it is in the approved CIH waiver budget, and even though I am doing the caregiving 24/7 and already pay double what two income families pay for rent. Any words or any word on advocacy for single parent caregivers to prevent this kind of discrimination and unfair loss of benefits due to shortage of reliable caregivers? One of the big things here is the state is looking exclusively at the waiver participant, at the person with a disability, and a lot of the conversation winds up coming back to the paid caregiver. The state is always going to in some ways almost ignore the caregiver questions and focusing on the waiver participant questions. So one of the things I would do, and I know that this is a whole lot easier said than done, but the hours exist. It's just that you can't be the one to get paid for them. So one of the things I would do is try to look into recruiting other staff. Again, I know that's easier said than done, but if you live near a college, maybe that's hiring an education major or a nursing student or somebody who wants to go into occupational therapy or speech therapy, something like that. Finding somebody who has the interest in disabilities and is planning to make that their career, but then hiring them on as a waiver provider. That way they're getting real life experience. Your daughter's getting quality people. Yes, you're going to have more turnover because they're college students. They will eventually graduate. But if you are willing to work with their schedule, including changing their changing the hours that they work based on their college schedule, I have found that to be successful. I have also found that with college students, sometimes it's more successful to hire them to provide services on a weekend, like on a Sunday or something along those lines, because that's a more stable day for them, and doesn't change with the semester. But that would be one thing to look into. But then also look at the people the people your daughter knows. See if you can find that other family who needs to switch off just like you do. And that way, you're getting paid for 40 hours to care for your daughter. That friend that you like, that neighbor you like, gets paid to provide 40 hours of care for your daughter while you are also getting paid 40 hours to care for their child. So finding that swap could be another option. I know that is a whole lot easier said than done. So I'm not trying to diminish that. that's just, one of the things that I would try to figure out. Um, okay. I am going to try to, I take it back. I'm going to try to focus on the questions on the caregiver piece of this, because we've got a whole lot of other questions that are coming in. I will get back to those, I promise. Um, how will this affect those currently receiving services such as behavioral and recreation therapy under the family support waiver? The only change to behavior services or rec therapy is that a relative cannot provide either of those services. So if Aunt Anne happens to be your rec therapist, Aunt Anne cannot be your rec therapist anymore. But the caps that were put in for both rec therapy, music therapy, and behavior therapy, those caps are still in place. There's not a change in the rate on those services. The only change is that a relative or a legal guardian cannot get paid for those. Um, oh, I missed this. This was actually a Medicaid work requirement question, and I missed that. Since the state is removing people from the waiver at an alarming rate, if an individual is removed from the waiver services, how soon do the work requirements begin? If somebody was on a waiver, the first thing I would be making sure of is that they're being assessed as medically frail, because most likely they would meet the medically frail definition. I can't guarantee that, but that would be the most that would be reasonable, and so that would mean that they are exempt from those work requirements. Also, if the Social Security Administration deems them disabled, they are exempt from the work requirements as well. Um, okay. I've got a whole lot of waiting list questions. I will come back to those. I want to focus on the paid caregiver part first, then I will come back to those questions. Um, let's see. Somebody was providing a lot of information on self-directed care. Again, we've got an entire webinar on that on the Arc of Indiana's YouTube channel. I encourage you to watch it, because it can be a viable option for people. Um, Somebody saying it's terrible that they are doing this change right at the time that we are all without active case management since all of the changes. It certainly has complicated things quite a bit. Um, what qualifies you and your child to provide and receive services to be a paid caregiver for your child? My child has high functioning autism, sensory processing disorder, severe ADHD, impulse control disorder, and developmental delay. Boy, does that sound familiar. Sorry, I'm saying that because, yeah, you just kind of described my son too. So I hear you there. Um, Part of it really depends on how old your child is. If your child is over the age of 18, you can be paid as a caregiver. That's not a problem at all. If your child is under 18, then they would, with those diagnoses, I'm guessing your child is on the family support waiver, and in that case, he he would have to have intensive nursing needs for you to be paid if he were under 18. But if he's over 18, hey, yeah, you could be a paid caregiver. That's not a problem. That's actually incredibly common. Um, are there changes that are going to be affecting DHI? Yep. Relatives and legal guardians can no longer be paid for DHI, which is dehabilitation. Um, if someone does self-directed care, no matter what the service, PAC, residential habilitation, attendant care, does I think that means rate reduction not go into effect? Correct. The rate reductions do not affect self-directed care at all. Um, I have heard that individuals on the CIH waiver cannot keep both residential and DHI services. That's not correct. It's that a relative cannot get paid for the DHI services, and a legal guardian cannot get paid for the DHI services. Services are still there and available to them. You just have to find a different caregiver or a different direct support professional to provide that. By the way, that's also with dehabilitation or DHI. That specifically can be a really great service to recruit a college student, or maybe a first or second year teacher, or an instructional aide, or something like that. And the reason I say that is um, dehabilitation or DHI is something that doesn't necessarily require long stretches. So that, that might be, a couple hours a week, and that you do every week. And so that's something that can be manageable as a second job for a lot of people. And there are a lot of people who are looking for second jobs right now. So the service is still available to everybody on the CIH waiver. It's simply, the change is that neither a relative nor a legal guardian can get paid for it, effective August 1st. How Okay, somebody's asking, how do we get contact information for the state or representatives to voice our concern? Do we have names, numbers, emails? Okay, this is a bit of a tease, because that is actually going to be part of what we discuss in our next Ask the ARC in August. Kim Dodson will be on, because we've had a lot of people who have reached out, who realize the world is on fire, who are unhappy with what's going on, and they're like, okay, we want to do something, but what do we do? Kim is coming on August 13th to talk exactly about that. So join us for that, please. Um, let's see. Okay. So I'm still confused on how having multiple residential habilitation caregivers works with the budget reduction. Case managers already note who the family member staff are and how many hours per week or month they use. Does the budget as a whole get reduced? Nope. Or there would be two different residential habilitation RH20 residential habilitation rates on the plan. Providers encourage family members to become staff because they already do the job, and now the pay is being reduced. It is supposed to be that the rate to the agency is getting reduced. The budget is still the same. The number of hours available is still the same, regardless of who the caregiver is. Let's see. Um, okay. Somebody was asking, is this being recorded? Of course it's being recorded. It'll be posted next week. The person who edits all of this is out this week. And so it'll be next week when it's posted. Um, I'm going through and I'm realizing that some of these questions I've actually already answered. So, um, why does it feel like they don't really want us to take care of our family members in our own home? I think they actually do want us to keep to take care of our family members in our home, because it costs them less money. So I don't think that is their intent. I do think their intent is to try to cut costs. Um, and 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 that's where, I mean, we do have to be mindful that waivers are paid for by taxpayers. And so we have to make sure that we are using them appropriately, and we have to make sure that we are using them responsibly. And the thing is, we are. It's a matter of, we have to make sure that they understand that is exactly what we're doing, is that we are using these services responsibly. We are using these taxpayer dollars responsibly and effectively, and that it is much cheaper for us to be providing these services in our home than in an institutional setting, whether that's a nursing facility or whether it's something else. This is the more cost effective option. This is the higher quality option. And that's part of what we need to make them understand. Oh, I have a client that is caregiver for their son. The son does not live there, but uses the client's, meaning the mom's, address for mail. Um, does the son need to change his address? I think that would be the smartest option. I think that that would be the easiest option to do that. Yes. If guardian is sister and brother in law of an adult individual and they all live together in the same home, sister and brother in law are paid caregivers. Can each caregiver continue to bill 40 plus hours a week, a combination of residential, transportation, and day habilitation? Or is it now 40 hours a week for total for all caregivers, for all services for this individual? Somewhere in between there. Sister can bill for 40 hours per week. Brother-in-law can bill for 40 hours per week. Transportation is not an hourly rate. That is a per trip rate. So that is counted differently. But neither can provide day habilitation or DHI anymore. But each one of them, sister and brother-in-law, can each bill for 40 hours per week. Um, um, Again, if you are the parent of an adult child, and you're the guardian, is it still only 40 hours total? It's 40 hours per guardian, okay, or per relative. So guardian could get paid for $40 or for 40 hours a week. Um, a separate relative could get paid for up to 40 hours per week. Um, Somebody said, so if I'm understanding correctly, some of the waivers don't include getting paid for caregivers. Um, all waivers have some way for caregiver for relatives or guardians to get paid. The details are in which waiver, which service, and that's really kind of what guides that. Um, okay, and somebody is asking about our chart. I'll be the first to admit, hate that chart because it is so confusing, but it's confusing because the information is confusing. So it says on your bulletin about who can be paid as a caregiver for attendant care of the parent of a minor child with the limitations, it shows a plus and the top of a triangle, or at the top of a triangle. The triangle says if the definition of extraordinary care and intensive nursing needs are met. I take that to mean that they have to have both for the parents of a minor child to provide that care. That is correct. And then I believe it was the plus, get them mixed up, is that for it's 40 hours for all LRIs combined. So yes. Um, let's see. So is that per relative? Each relative can get paid for 40 hours per week? It's up to 40 hours per week, but yes, because part of it is you also have to have that much in your budget to do that. If somebody's on a family support waiver, if they are using 40 hours a week, It is technically possible. It is just not common because if you bill 40 hours per week, you're going to run out of your family support budget in about 7 months, and so you're going to go for about 4.5 to 5 months with no services at all. But if you're on like the CIH, Health and Wellness, or TBI, or Pathways for that matter, it can be up to 40 hours per week. Yes. Uh, let's see. Um, Is the state addressing the shortage of non-family caregivers to cover all of these changes? That is a ridiculously fair question. Or is the strategy for us to just give up and let the already and let the money just go back to the state? I am somebody who is always going to fight that. The ARC is somebody who is always going to fight that because it is important that people with disabilities actually get the supports and services they need to be able to live their lives, to live the lives that they want to live. And we have come so far, we're not going to go back. And so, you know, is the state developing some strategies to address this? They are. They have been trying to develop some programs to professionalize DSPs, and to try to recruit more DSPs and try to figure out how can we recruit more caregivers. That's part of why they extended self-directed care options to the developmental disability waivers, is to try to be able to recruit um, more caregivers. Um, are there things that they are trying to work on? Yes. Are they fast? No, nothing's ever fast. There's government fast and there's human fast. Those two things are not the same. Um, but are there plans in the works? Yes. Um, um, there are several different options in there, and there have been several different options that they've been working on for years, and so it's just you know trying to get those to come to fruition, and start actually uh, recruiting more DSPs. But it's not just about recruiting DSPs, it's about recruiting quality DSPs, people who care, people who are going to do a good job. We've got way too many stories and parents who have shared where this was just a warm body. They did nothing. They stayed on their phone the whole time. They watched TV the whole time. Um, and those don't include the horror stories. We want DSPs who actually work with our loved ones, who actually care about our loved ones, who are trying to help them get out and live the lives they want to live. So it's not just about recruiting caregivers, it's about recruiting good caregivers. Um, and so I think there's going to be some more efforts on that part. One of the things that was announced today is that the state is putting a moratorium on new providers for certain services. Like, it was a long list of services that it would affect and a long list of services that it would not affect. And a big part of that is because um, we've got a lot of provider agencies right now, and some are good and some are just warm bodies. And so part of what they're doing right now is also trying to go through and figure out, you know, set more standards for providers, set more quality standards, because one of the other things that the state is going to be focusing more on is looking at quality outcomes for these services. And so I think you're going to see more movement on that. Um, and with the goal of getting more, not just more caregivers, but more quality caregivers. My company says we cannot get paid training or holidays since it would be over 40 hours. Is this true? That is where I would talk with the Department of Labor or a labor attorney for that. Okay. I know it sounds like I blew you off. It's that I'm not an attorney. That's technically a legal question. I should not answer that, but I want you to get that answer because a little bit of a gray area there. Um, so Somebody's shouting, this is totally discrimination against paid relatives. Why would anyone want to have a person unfamiliar with their loved one come in off the street and be paid 60 hours to provide care? Fully understand where you're coming from. I will also say we've had some really great people who have worked with my son who I never met until an agency brought them in. One was a young man who was in college. He was in college to become a music therapist. Didn't know that at the time. I just knew he was a college student. He was with my son for about 5 years. They had a great relationship. They went out and did all sorts of things. Before that, he had a couple of DSPs who were really working on social skills and really working on conversation skills and all that. They were people I did not know, but they were absolutely wonderful with him. So there are some really, really good DSPs who don't have connections to your loved ones, but who can be really good. There are also some who are not. So yes, you absolutely have to meet these people, have to vet these people, find out who they are, what they're doing, and all of that. But there can actually be good people who aren't related to your loved one. Um, okay. Sorry, I'm reading that question. That's one we're going to get to in a little bit. Um, can a guardian who is being paid for residential habilitation also get paid for transportation? Yes, they can. Um, and part of that is because again, transportation is not an hourly based service; it's a per trip service. So when we're talking about that 40-hour cap for a relative, transportation is outside of that because it's not an hour. Um, I am currently in the process of opening an adult day program, and it's a nonprofit. My adult daughter, who has autism, will be a client. Does this mean that my adult day program would not be able to get paid if she attends? That is how I understand these new rules. Yes. So you are welcome because you are trying to become a provider right now. And by the way, I think you are going, if you have not already been approved, I think you are going to be hit by that moratorium on new providers, which is a 6-month moratorium. But I would contact Beads Provider Relations to get that clarification from them. But as I read things, yes, I think that you would not be able to get paid for your daughter as a client in that. Um, we care for a relative as guardians in our home and are both paid caregivers. So does this mean that we can only do 40 hours between the both of us, or that we both can get paid for 40 hours? You can both get paid for 40 hours. Um, okay. I provide PA hours through one company for 40 hours a week and weekend family support waiver pack hours through another company. My son is 34, lives at home, and cannot work. There's not actually a question there. I think you left it off. But I think what you're trying to figure out is how will these changes in being a paid caregiver affect you? The only change that I see is that the agency who bills your PAC services would get a lower reimbursement rate. Because your son lives with you. But none of the changes currently will affect the PA hours you get. You even as a legal guardian, you don't say that you're the legal guardian, but whether you are the legal guardian or just mom, you can absolutely still get paid to provide pack hours for your son. So that part does not change. Can you be paid for structured family caregiving and attendant care for disabled adult children or disabled kid at the same time ever? What is the require? Okay. Um, you cannot get paid for structured family caregiving and attendant care for the same person. It is an either or. And what the age of the individual is irrelevant to that. It's that structured family caregiving and attendant care are mutually exclusive. You got to choose between the two. What is the requirement for transportation pay? That's where you're going to need to talk to your case manager and get what's called a pick list for transportation. Then start talking to the companies who provide transportation in your area. Transportation is one of those services that is based on a per trip as opposed to specific mileage or as opposed to like a time amount. It's based per trip. You can bill up to 2 trips per day, but no more than that. And so start by getting a pick list from your case manager for transportation and start by talking to the transportation companies to figure out if that is an option for you and how that would work for your life. Um, okay. Can legal guardians of adults who are being paid for residential services or structured family caregiving also get paid to provide PA or home health hours? As of right now, the answer is still yes. I say it like that because earlier this year, the state initially changed the home health services manual to prevent that, but the changes they made were so vague and could be interpreted several different ways. The state rescinded it. They took it out of the home health manual. But when they did that, they were very clear that they were working on rewriting that. So for right now, can you do that? Yes. Will that change in the future? It is very possible. Um, if only 40, if 40 hours only between two caregivers, do those other hours then be used for other services? It all depends. So first of all, if you're talking about 40 hours between two caregivers, I'm going to assume you mean for this is for a child under the age of 18. Um, Part of it is when hours are approved, they're approved for a specific service. Now you can work with your case manager to potentially reallocate those additional hours to another service, or you can bring in a different caregiver to fulfill any unused hours. But if the individual on the waiver is over the age of 18, it's 40 hours per caregiver. Um, A higher wage per hour will mean fewer hours of support with allocations not changing. And I think you're referring to self-directed care. One of the things is the amount of money you are paying that caregiver for self-directed care is still less than what an agency would get paid. And so, but that is actually part of the consideration with structured family care, or excuse me, with self-directed care, is that you get a set amount of money to be used for that self-directed care. If you pay a lower wage, you get more hours. If you pay a higher wage, you may get fewer hours. And so that is all part of the calculations you have to do in looking at self-directed care. Will they be responsible to do background checks, CPR, if they hire their own caregivers? They do background checks. So when you're doing structure, I keep saying structured family caregiving because that's what I've been talking about so much. When you are doing self-directed care, they still do background checks, but you as the employer are the one who is responsible for their training. So you can you can require them to have CPR training. You can pay for them to get CPR training, but you can't use waiver dollars for that, but you could private pay for that. So and then you are the one who's actually providing the training and all of this. So some of that is up to you. um, Uh, does a state agency or a care manager or a case manager come up with a care plan and how many hours? Well, first of all, I'm going to say you need to be a big part of that. And the client needs to be a big part of that because one of the things waivers are supposed to do is they're supposed to be very person centered. In fact, The care plan is called a person-centered individualized support plan. So it's about what services the individual wants, and then who they want to provide those services. So the case manager is the one like actually writing it up, but with at the direction of the client and their legal guardian if they have one. With the family support waiver has a cap of services. So there, you are more limited in hours. For like the CIH waiver, they do an assessment called an ICAP, which is what currently sets the individual's budget. I'm saying this, all of this will change in the next year and a half or so. Okay. But that ICAP assessment, it helps figure out what the individual's actual needs are, and that is used to create their budget. And then once your budget is set, you get to determine how you want that budget used. So, okay. Okay. We had a question earlier um, about levels with the health and wellness waiver, and this person answered, the level of service determines the pay amount. And yes, as long as the level, uh, yes, as long as the level of care done by Maximus is approved. Um, Sorry, that question was a long time ago. I sort of remember it and I sort of don't. But I think that was the question where we had questions about level 3 versus level 1. And the person was asking, okay, my son is now a level 3. If he drops to a level 1 and loses his level of care, what happens? And I think what they were saying is it's not just exclusively a level of care, it's also a level of service. And they may be answering more now too. Um, so there are multiple steps in all of that. Okay. Uh, Okay, somebody is saying that they think there's another change that's going into effect August 1st that can impact people receiving rec therapy, behavior support services, um, and they want to talk about that a little more. The only change the change I know of is who can be paid to provide those services. If you want to provide some more information about what you're thinking about, because I know you want to talk about it, by all means, please do. But let's figure out if you can give me a little more information, I'll absolutely address it. Can a health and wellness or pathways member receive both structured family caregiving and transportation authorizations? I am pulling this off the top of my head. It's something I would rather look up, but I believe that transportation is built into structured family caregiving. That's something I would want to double check in the manual though. Um, Oh, structured family caregiving level 1 will not disqualify someone from the waiver. They need to continue to meet nursing facility level of care, and that's done with Maximus. Structured family caregiving determines how much per day the individual will receive on the service authorization. It isn't tied to eligibility. That is what I love about this group. We crowdsource answers, we use our knowledge, and I am so grateful for you guys. Um, Can an aide working with your kid at school be paid extra through the waiver on top of what they get paid from the school? I get paid only for structured family caregiving. Waiver services cannot be provided in the school at all. Okay. But could you hire your school aide To provide waiver services outside of the school, yes, that you can do. They just can't provide services in the school. Um, Other than structured family care, who can care for an adult on the highest level of care? Must it be a nurse or a relative who has lived with her their entire lives until recently, and can administer the feeding tube? Okay. I'm going to guess you mean on the health and wellness waiver. Um, and so, I mean, other than structured family caregiving, you could use attendant care. It's just a matter of the spouse could not be paid for that. Um, but anyone else could get paid for that. Must it be a nurse? It's going to depend on the individual, whether they need an actual nurse to provide services or whether or not. And that's going to be based on the individual's need. Um, so I know it feels like I'm not answering your question, and I'm kind of not answering your question, but it's because it depends on the actual individual and whether their level of need is high enough that it must be a nurse to provide the service, or can it be somebody else? And that's going to be individualized. Okay. Um, I've got a question here where it's really asking more about billing type questions, and I can't answer those billing questions. Um, but the second part of the question is if the individual has both family and non-family staff. If you've got family and non-family staff, the regulations are going to be different, and how much they can get paid is going to be different because only the family would be limited in the number of hours they can serve. The rate reduction only applies to 3 services and only if that caregiver actually lives with the individual. So if it's a non-family staff person who does not live with the individual, their rate is not going to be reduced. If it is a family member who does not live with the individual, their rate is not going to be reduced. But with a family member, they're going to be limited to 40 hours per week. Okay. So here's one of those times where I'm gonna tell you you got to be a little bit careful in the words that you use. Okay, and I only say that because you can get incorrect information from it. Does the state understand that parents are doing the adult day service hours because oftentimes day services do not have staff to support our loved ones? This keeps them out of the adult day program, especially and specifically, we have found because our son uses a wheelchair. Um, I have I have found this discrimination and not what the waivers were designed to do. Keep our loved ones connected to the community as adults. This is why many providers provide the adult day program hours. This new rule will result in them not attending. Period. Does the state understand this problem? Um, so there's a difference between adult day services and providing services to someone during a day or providing services to an adult during the day. Adult day services is typically like a program in in an agency's offices, whereas and so it's billed through the agency. Um, but if you're saying that the parent is working for the agency because otherwise the agency wouldn't allow the adult in there, that's a different thing. But if really what you're talking about is you're providing the services during the day because there's nobody else available, that's not adult day services. And it's not that I'm trying to be dismissive or trying to, I don't want that to come across as being lectury, because I don't mean it that way. What I mean is um sometimes you got to be careful, just because the state's definitions on certain things and a regular human's definition on certain things can be different, and sometimes those words can trip you up and actually cause some harm. um Okay. Somebody's like, that's I'm guessing in response to how we can get some additional caregivers. That's all great, except we're already exhausting our emergency people. So asking them to become permanent parts of the team is not viable. You're not wrong. Um, yeah. Um, yeah. Um, Somebody's asking, will this presentation, including the Q&A, be available on YouTube? Yes, it will. It'll be next week, but yes, it will. Um, okay. Okay. So, as a provider, can we be the ones to determine if that client meets the definition of extraordinary care and has the extensive nursing needs under the health and wellness waiver for attendant care? Or do we coordinate that with a case manager and determine it together? Um, you guys would put in the request, but the state is going to review it to make sure that it meets that definition. So you can say, hey, we believe this person meets this definition. The state is going to want to have the documentation to confirm that. Um, Can a caregiver or legal guardian of an adult provide some pack hours and another person provide more or additional pack hours? Yes, absolutely. The only thing is with PAC, because you're saying PAC, I'm going to assume that you're on the family support waiver. The only limitation to that is simply going to be that the family support waiver has a capped budget. So there are limited hours for everyone with that. Um, okay. Um, Somebody's saying if we can't fill hours with a random caregiver that we're not familiar with, we'll lose the hours in the budget, and once they're gone, they're gone. I'm going to push back on that. And don't get me wrong, I recognize your experience with this, and I know that especially in the last 2 years, there have been a ton of rate cut or a ton of hour cuts. I won't say that it's gone forever. I will say that is something you can absolutely appeal. You can absolutely provide more documentation to show that the individual needs more hours. But as for once they're gone, they're gone. Nope, you can absolutely push back on that if that's what the individual actually needs. Um, so being on SSDI is not a qualifier for being eligible for the waiver or staying on the waiver as an adult. It's more complicated than that. So being on SSDI proves to Medicaid health coverage, that you have been determined disabled by Social Security, which gets you the right type of Medicaid for the waiver. But just being eligible for SSDI does not guarantee that you are eligible for the waiver. Um, so I know that is complicated. You have to have the Social Security determination to have the right type of Medicaid to have the waiver, but that alone does not keep the waiver for you. Um, uh, let's see. Um, how is the state cutting costs, saving money, or being cost effective when the budgets remain the same? That is an excellent question. I cannot answer that because I would get in trouble, but you're thinking along the right ways. Um, let's see. My daughter's assessment says she meets nursing facility level care. Would that meet the intensive nursing needs? No, not necessarily. Nursing facility level care is a much broader determination. Intensive nursing needs are specifically um, medical interventions that a nurse has to provide, like somebody who's using a continuous ventilator, like somebody who has to get all of their nutrition through an IV, like someone who um, Oh goodness, I remember continuous ventilator. I remember TPN. Um, I forget what the third one listed is. But in so think of it as as all people from Indianapolis are Hoosiers, but not all Hoosiers are people from Indianapolis. Um, all intensive nursing needs are going to wind up meeting nursing facility level of care, but not all people who meet nursing facility level of care will meet those intensive nursing needs. Um, um, so if my husband and I are both legal guardians of our daughter, and I'm going to assume you mean your adult daughter, can we each get paid for 40 hours of attendant care on the health and wellness waiver? If she's an adult, you sure can. Are the case managers going to home visits and the caregivers not present? Well, are the case managers going to home visits and the caregivers not present multiple times? Will the agency lose the NOA or just be notified of the issue? If the case manager is going, they should, maybe I'm figuring this out now. So ideally, the case manager should be setting up appointments to make sure that the caregiver and the waiver client are there. But one of the things is case managers are also supposed to be doing unannounced visits on occasion, and that's really a safety issue to make sure that everything is okay and that the individual is safe. Um, if it's the unannounced visit and they're not there, that is one where I would talk with your contact at Beads to figure out, okay, what is a reasonable number of attempts to do this, and once we've passed that reasonable number of attempts, what guidance do they have to help figure out how do we actually make this happen and get and work with Beads on this, because it's one of those things where none of this is meant to be punishment. None of this is meant to be punitive. And Beads is more than happy to work with providers, especially on something like that. The state has a $6 billion surplus, so why are we cutting more and more of our community here? I think that is an excellent thing to talk about with your legislators. Um, let's see. Okay. Um, let's see. Um, somebody is sharing that there's a lot of really good information we've talked about. Yes, it's going to be posted to YouTube, but she also mentions that her English is limited, um, and she couldn't get the translated captions to work today. Would you mind enabling the translated captions feature in Zoom settings? You know what? I will absolutely talk with Sally to figure out how to do that. That is a really, really good point. I'm glad. Genuinely, I'm glad you brought that up. I know sometimes that sounds like a throwaway line, but I'm glad you brought that up because I want to make sure that we can do that. Um, there are over 2,000 attendant care providers. They are finally auditing and finding fraud. Limiting case management is not the way to help individuals. Um, and one of the things too is that is part of why the state announced earlier today that there's going to be a moratorium on allowing new providers for a large number of services is so that they can go through and make sure that the service providers who are out there are high quality providers, are following all of the rules, are and so we are going to see some changes with all of that. Um, doesn't a moratorium on new providers prevent access and choice? Well, you still have choice of the providers who are there. It's just that they're not allowing new ones in for the next 6 months. Um, there are very few providers in our rural county, and I know a lovely young lady who is about to launch a business. So, what I will say is, first of all, it takes a long time to get in normal circumstances, it takes a long time to get approved as an agency. Keep working on the paperwork, and I would also pay attention when the state is putting out new information on this. They'll normally do that through their subscription service, through their email subscription service. Um, don't give up. Go ahead and keep working on that. I don't know if existing providers would be able to branch out to additional counties. I know that part of the moratorium is even if we've got an existing provider agency, if they did not provide a certain service before, they are covered by the moratorium. I just don't know if that also extends to whether or not to geographic area. Um, if you are getting paid for home health or for attendant care, for the care of an adult and a child, do they have to be home for those hours to be paid? Um, So there are some exceptions to the idea that they have to be home, and part of it is dependent on what the other activities are that they are doing. So there are some ways that you can be providing home health services, for example, outside of the home. It's any environment that a person would naturally be in. So, for example, um, you can use home health services through Medicaid health coverage to pay a nurse or a home health aide to go to school with a child, or to go to somebody to their workplace to provide those nursing or home health um, activities. Um, but you know, but there are some specific regulations from that. I would have to look them up to get into the specifics of it. Those are the parts I remember. Because it was any natural environment where they would be. So something like school, something like a job. But I don't know that going to a concert would qualify. But I would have to look it up. Um, I am a single caregiver providing care for my two adult daughters, both on the waiver. How is this fair that because I have no spouse, I am capped at 40 hours and the family with two parents would be able to work 40 hours each? Well, first of all, you can get paid for 40 hours for each one of your daughters. So that alone is 80 hours. Um, so, and it's more that, you know, it is exclusively about limiting how much they are going to pay you. And I hear your anger, and that is absolutely something that you can bring up with your legislators. Um, so um, So you can provide PA and waiver services, and it can be more than 40 hours. So, for example, 20 hours of PA and 40 hours of residential services. Yep, because they are two completely different funding streams paid for by two different programs. Um, I am so confused. We were just told that I, mom and legal guardian, could not do both attendant care for 40 hours and PA for 14 hours per week, but I can do both. Assuming your child is an adult, yes, you can. And part of the confusion, I think, goes back to the fact that earlier this year, the state had changed the home health manual, and not everyone has realized that they rescinded that change. I also want to stress that that is true right now. The state has said that they are rewriting that. So it is true right now. I cannot guarantee that it will be true in the future. But yes, as of right now, you can do both attendant care and PA hours. Um, so here's where we have a semantic issue. And so I'm going to assume there's an acronym there. I'm going to assume that an agency's acronym, is saying that the primary caregiver cannot get paid for any type of waiver service and PA service. This is where the definition of primary caregiver comes into play, because a primary caregiver cannot get paid for PA services. That is accurate. That is the way the manual is written. Who determines who's the primary caregiver? If you've got a two-parent household, for example, who's to say whether mom is primary caregiver or dad is primary caregiver? I would say would be the parents who would say who the primary caregiver is. So that's where word choice makes a huge difference. So, do we say that dad is primary caregiver and mom is getting paid for home health? Are we saying nope, mom is primary caregiver and dad could get paid for home health? That's why that matters. Okay. Can my husband be on structured family care and then I be on PAC for 40 hours? Our adult son has the health and wellness waiver. PAC is only a service available on the family supports waiver. So health and wellness doesn't have that. If you are currently getting paid for structured family caregiving, that is a per diem rate. You said, though, that your son is an adult. You don't have to use structured family caregiving. Because your son is an adult, you can actually switch over to attendant care. And so that's a discussion to have with your case manager to figure out which service is better for your son and for your family. Um, So there are a couple more questions about home health, providing both home health and waiver services. And again, I think the confusion here is because of that change that was made earlier this year and then rescinded. So the current manual does not prevent somebody from getting paid for both home health care and for waiver services at this time. That is likely to change in the future. Um, can I provide residential services outside of the home? My daughters, who are both on the waiver, have specialists who are not local, and traveling to and back is too much to be doing in one day. So we often go to a hotel for a night for these appointments. We also have community outings such as going to the movies and dinner out. These have always been paid as part of DHI. You can absolutely build those into residential services because that's something that is actually common with residential services too. So yeah, going out to the movies, going out to dinner, that can absolutely be part of residential services. Um, going to doctor's appointments and staying in a hotel for the night. I'm going to say that might depend on if it's in the state of Indiana, yeah, that's an easy one. If it's outside the state, you need to look into it a little bit more. And off the top of my head, I cannot remember that rule. I would have to look it up. Um, so let's see. So if you can't use waiver dollars for CPR training for caregivers, does that mean all training? Oh, we're going to break this up. Okay. So, first of all, when I was talking about that, I was talking specifically about self directed care, that you cannot use the money for when somebody is using self directed care, you cannot use your waiver dollars to pay for the CPR training for the person you are hiring. But if we're talking about, hey, can, mom who is an unpaid caregiver, use a waiver to learn CPR? Well, there's a service on the Family Support and CIH waiver called Family and Caregiver Training. That could potentially be used for CPR training, but it's only for it's training for an unpaid caregiver is the issue. So I know that it even feels to me like I was hedging on that question. It's because the details matter on that. If we're talking about self-directed care, Your waiver budget cannot be used to pay for the CPR training for that person you hire. But if you're talking about, an unpaid caregiver, like a family member learning CPR to help care for the individual, that you can use family and caregiver training for, or you should be able to. Does anyone else's head hurt? Mine sure does. Yes. Yes, it does. Me too. Um, okay. My son, who is 16, recently became disabled within the last 2 years. He lost the ability to use his right hand. Um, okay, here we're about to get into a whole bunch of personal information. So now I want to kind of review this a little bit. Um, okay. When all of this was going on, I think we applied for things like Social Security and Medicaid, and I think we were denied. Um, if so, what do we do next? I can tell you right now, the reason you were denied Social Security and Medicaid at that time is because Social Security, because he is still a child under 18, Social Security is absolutely going to look at family income and family assets. So basically, if you own two cars, your child under 18 is not getting approved for Social Security yet. With the Medicaid, because he did not have a waiver in place, they were using the normal Medicaid financial rules. If he were to get a waiver and be ready to start his waiver, and that's kind of the difference here is, it's not just that you've applied for the waiver, it's when you are ready to start the waiver. That's when the waiver income and asset or income rules change, whether that's increasing the income limit, but then also not looking at family income. It's when that person is ready to start the waiver. Um, So, since we were probably denied for Social Security and Medicaid, can we even be paid caregivers for our son? Again, you've got to wait until he actually has the waiver in place, because it's the waiver that's actually paying for it. How do we move forward? So, well, the first thing I'm going to do is, my dear, give us a call and talk to our family advocates. That way, we can go back and forth, and because you're going to have a lot of follow up questions too. But with the types of things that you're talking about, um, it definitely seems like there are physical disabilities. There may be some intellectual disabilities in there too, and so we can look to figure out which one is best for him, and figure out how to go. So give us a call, talk with one of our family advocates, so that we can have that give and take, okay, and really kind of answer the follow up questions you will have, because my dear, you will have follow up questions, and that's okay. Okay. Somebody was confirming you cannot do transportation and structured family caregiving, because transportation is built into structured family caregiving. It's exactly what I was thinking. Thank you for confirming. Um, can structured family caregivers be paid for more than structured family caregiving, and for other things? Um, and so there are the details are going to be in the waiver manual, because with structured family caregiving, it does prevent certain other services. I always have to look that up. I cannot remember that off the top of my head, and which services are included and which services are excluded will change whether we're talking the health and wellness waiver or whether we're talking the CIH waiver. Um, Sorry, I'm reading this message first. This person has gotten a lot of bad information. That's really the only way I can say this. Um, so what I will say, and I'm writing down your name right now. What I will say is, we've got a person whose child has switched from health and wellness to family support, um, and there have been a lot of changes as a result of that, and trying to figure out which is the right what would be the best option for them. I am writing down your name, and I should have your email from when you registered, my dear. We're going to give you a call, and we're going to talk about this because this is this is something um, that is going to be really specific, and it's probably going to be a long conversation. But I want you to be able to talk to somebody. So I have written down your name so that we can reach out to you. Okay. Um, okay. Okay. So we've gotten several questions about the moratorium that the state announced today. The state announced that they are placing a 6-month moratorium on approving any new providers for certain services. I cannot remember the services off the top of my head. It was a big list of which services were going to be placed under a moratorium, and a big list of ones that were not going to be placed under a moratorium. That was just announced today, um, and so um, and so we've gotten a whole bunch of questions about that, um, and so I know the moratorium is out there. In all honesty, I would have to, sit down and focus on the memorandum so that I could answer those questions. I was updating this presentation today, so that was taking my focus. But you know what? Go ahead and give us a call so that we can talk about it more and answer your questions. Okay. Um, let's see. Ah, okay. So for the person who's writing a whole lot of the person who's asking most about the moratorium, I'm gonna give you a call. It's either gonna be early tomorrow morning or late tomorrow afternoon because I've got some things from like 11 to 2:30, or we can talk next week. I want to be able to review it and get back with you. Okay, I'm not trying to blow you off. I just want to make sure I'm getting you I want to make sure that I'm getting you correct information is really all it is. Okay. Okay. Um, oh, thank you. Somebody earlier, I was drawing a blank on what the second thing was for the intensive nursing needs. Somebody totally came through and answered it for me. I was forgetting trachea care. Thank you. Um, let's see. Uh, What do we do when we have a not so good case manager on the family supports waiver? You fire him, sunshine, because guess what? You hired him. You could fire him. And right now is actually a good time because the reality is because we've got the changes in case management companies, it's going to delay things. Don't get me wrong. But we've got a whole bunch of new people. There are now 5 companies that you can choose. Call them up and interview them, and find a case manager who has more knowledge in what you need. So, for example, if you've got a loved one who is in that transition to adulthood phase, you want a case manager who is really well versed in transition to adulthood. If you've got a loved one who has both developmental needs as well as more medical needs, you want somebody who actually understands what that means. If your loved one is actually aging and you're starting to deal with the aging world, you want somebody who knows what that needs. And if you've got somebody who specializes in finding supports for kids, but your loved one is 64, that's not going to be a good match. even if they're a great case manager, it's just not a good fit for your specific situation. The good news is you can always change not only case managers, you can change any service provider at any time and for any reason. It's simply a matter of looking around, finding who's available, finding who's going to be a good fit for your situation and for your loved one. It's still a little bit early for resource fair season, although I'm starting to get those. I'm starting to get those invitations now. I like getting people to those community resource fairs or to those school transition fairs because instead of having to make 900 phone calls to figure out who does what and what they're like, you have a bunch of them all in one room. And you just walk from table to table to table. So that's one of those things that I always recommend. So see if there is something coming up in your area. But, if you don't like your case manager, my dear, you always have the right to change. Is attendant care and home health aid hours the same? No, they are different. One is a waiver service, one is a Medicaid health coverage service. So they are completely different services. Can a parent be paid for structured family caregiving and the other spouse be paid for something else? Um, it is possible, but with structured family caregiving, there are certain services you cannot get while getting structured family caregiving because that service is built into structured family caregiving. So, for example, if you're getting structured family caregiving, you cannot get attendant care because it's built in. You cannot get transportation because it's built in. You cannot get caregiver coaching because it's already built into structured family caregiving. Same with respite, but there are other services that you could potentially get paid for. Um, I was told that I could no longer bill PA hours and PAC hours come August 1st. My son is 35 and I'm his legal guardian. Is that true? Nope. Um, billing PA hours and PAC hours billing PA hours has absolutely nothing to do with the August 1st changes. Do I believe you were told that? Yep. It is the confusion that is going on right now. But no, as of right now, there are no changes in who can be paid to provide PA hours. As long as you are meeting the requirements for it, that is the determining factor. Um, So, to provide attendant care for our adult daughter, she has to be on a vent, have IV feedings, or be hooked up to some kind of machine? Nope. Your daughter is an adult. The requirements for those intensive nursing needs, like a ventilator, like IV feedings, something like that, that is if the parent of a child under 18 is getting paid. Your daughter is over 18, so no, that does not apply to her. Um, let's see. Um, uh, my son is an adult and on the family supports waiver. Can I get paid for that? There are several services you could potentially get paid for. Um, Starting August 1st, the number of services that you could potentially get paid for is cut pretty dramatically. But there are still several services that you could. At the same time, part of it is you also want to make sure that it's in the best interest of your son. And what I mean by that is, if he is using his waiver for rec therapy, for example, well, you can't get paid to provide that rec therapy for him. So is it more important that he still be able to do the rec therapy, or is it more important, for you to be paid? And I don't mean that in a judgmental way. It's about, making sure that we are looking holistically, at the whole person and what services really do benefit them well, and making sure that they still have access to those services. Um, Okay. Um, my son is an adult with a family supports waiver. He makes this he makes the decision, correct? I don't know if we assigned a document that it was okay to talk to me about his waiver. So part of that, so your son is an adult, and that does make a huge difference. um, if you are his legal guardian, you would be the one making the decision. If you are not his legal guardian, he makes the decision, just like any other adult would. And part of that is we want to make sure, first of all, we want our kids to be as independent as possible, to lead their own lives as much as possible, but we still need to be there to help support them in that, however they need it and however they want it. So, can you be involved? You absolutely can be involved, even if you are not the legal guardian. Um, can people talk to you? Yes, they can absolutely talk to you, but they might have to have your son's permission before they are allowed to talk to you first. And that's really because waiver services are in that healthcare realm. It's a HIPAA issue, so it's a health information privacy issue. So, can they talk to you? Yep, your son just has to give them permission first. Um, let's see. When targeted for the waiver and told to apply for Medicaid, how long does it typically take to know about Medicaid approval? Oh my goodness, my dear, that's a question. Um, so, and I say that because there have been a lot of issues with Medicaid over the last couple of years. When somebody has been targeted for the waiver and they apply for the waiver, um, because you are trying to get a disability category of Medicaid, Medicaid has 90 days to make their decision on whether the person qualifies. One of the things I am seeing is that Medicaid keeps wanting more and more information, but they don't always communicate that they want that information. So one of the things I would do is I would make sure that you have created a Medicaid benefits portal account and make sure, and then you can look through that account to see what documents they have solicited, meaning what documents they have asked for, and then what documents they've received. But they actually have, once they have all of the documents, they actually have 90 days to make that decision. So can I switch my adult son from structured family caregiving to attendant care? Yes, you can. What would the benefits be? Um, Really, the benefit is more that, frankly, that you'd be likely be paid more for attendant care than you would for structured family caregiving. Um, let's see. Would I have to switch my other minor son to that too? No. And can he stay on structured family caregiving? Yes, your minor son can absolutely stay on structured family caregiving, and that. Oh, they have Duchenne muscular dystrophy. I Hello, my dear. I'm glad you joined us tonight then. Um, so um, it is easy because your younger son is still a minor. It is easier for you to get paid for structured family caregiving than it would be for you to get paid for attendant care. But because your older son is an adult, you could easily switch to attendant care. Adults do not have to have that intensive nursing need for a guardian or a parent or a relative to get paid for attendant care. Okay. Um, My son just got invited for the Medicaid waiver, and the paperwork says he has to be on Medicaid first. But every time we apply for Medicaid, we get denied because of our income. How do we get Medicaid to get on the waiver? We were told once that we got the waiver, we would get Medicaid because our income wouldn't apply. My dear, you are not alone in this. Um, so, first of all, now that he's actually been targeted, meaning it's time for him to start the waiver, go ahead and submit a brand new application for Medicaid. When you are filling out that application, there's a question that asks, is anybody in the household disabled? When you say yes to that, it creates a drop down box. And one of your options is to say that your son has been targeted for the waiver. When you click that, that's what tells the Medicaid computer system to use the special income limits of the waiver and to ignore family income and family assets. So it's you've got a bit of a hiccup with the application itself, and it's because it's a hidden question. So you want to make sure that you say yes, your son has a disability, and he's been targeted for the waiver, and that should help you get through that. Um, My special needs daughter, who is on SSI and Medicaid, was on the waiting list for the Health and Wellness Medicaid waiver. Do I need to do anything else while waiting to be accepted? Um, I do stay at home with her and I'm her primary caregiver. Is the Health and Wellness waiver the one I need to be able to be paid for her as a caregiver? Um, it's more a matter um, of which waiver she qualifies for and which waiver actually meets her needs. The fact that she is on SSI and Medicaid will make this process easier when she actually gets targeted for the waiver. The health and wellness waiver is really designed more for people who have more physical disabilities or who have more medical needs. Their purpose is to help people stay in their homes and not go into a nursing home. So it's really kind of that focus that matters here. Whereas the developmental disability waivers are designed for people with an intellectual disability, which means an IQ of around 70 or below, or they have a developmental disability. And you know, those waivers are designed to help people get out and be as active in the community as possible. So the type of waiver really depends on what her disabilities are and what her needs are. Is there anything you can do to speed this up? If your daughter wound up going into the hospital, and not just an ER visit, not just an outpatient thing, but was actually like admitted to the hospital, you could call Max. You would need to call Maximus while she was still in the hospital. Tell them she's on the waiting list for the health and wellness waiver, and she's in the hospital, and she needs that waiver to safely come home. That would help. That would speed her up on the waiting list for the health and wellness waiver. If she were on the waiting list for the family supports waiver, if she were between 18 and 24 and finished school, that would get her priority status. Or if she had a parent who was an active duty service member or veteran, that could speed her up. Um, but the health and wellness waiver, I was looking this up. I think the health and wellness waiver is targeting people who signed up in April of 2025, just to kind of give you an idea of where they are at. Um, let's see. You know, we've also got a lot of people who are sharing that that their hours have been cut, and that's something that has been incredibly common. I think one of the biggest reasons why a lot of people's hours were cut was because they needed a whole lot more documentation on what the individual needed, what those hours were providing, why they actually needed that many hours, and what they would be doing during it. So I think a lot of the hour cuts were really were in large part because Medicaid has started requiring a whole lot more documentation and a whole lot more detailed documentation, and that's not something that they've had to do in the past, and so and so I think that's one of the biggest parts to that. Um, okay. I think at this point, I have answered um, most of the questions that I am seeing here. Um, so here's the thing is that I know this is complicated. And I know if you are anything like me, you're going to think of another question tomorrow, next week or 3 weeks from now, give us a call here at the ARC. We will absolutely, talk with you to figure out what all is going on. If you have, you are welcome, to have your provider agencies call us, your case management agencies call us, because we know this is all really, really confusing. And so we want to be able to help people get the supports and the services that they need, and make sure that people with disabilities are able to live the lives that they want to live, to be able to have a quality life. And that really does mean making sure that they've got the supports to make that happen. So, ladies and gentlemen, thank you so much for joining me tonight. If you are still on with me, bless your heart. Thank you for that. I know this was really, really long. Wow, this was even longer than I expected. I hope this was helpful. I know how confusing this has all been. So I hope that this helped clarify and answer a lot of the questions you have. And again, you're always welcome to give us a call here at the ARC. You can reach us at 317-977-2375. Ladies and gentlemen, thank you so much for joining us tonight and have a wonderful evening. Goodbye.